So, first things first, I just want to start by breaking down sort of the numbers that we're seeing. As the CDC says, we've already surpassed last year's measles cases. It's only July. How significant is that stat?
It's very significant because what it tells you is that measles is becoming more common. Measles is basically spreading in multiple states. And because the level of immunity in the population is lower than the threshold we need, it's finding an easy time to get to new people to infect. And this might be the new normal, that we don't have years of just single digit measles cases. Now measles cases might be in the thousands, which will translate into people being hospitalized, people having severe cases. And this is what we're watching, is this disease reestablish what we would call endemicity in the United States.
You mentioned that threshold that you guys need to see. Can you explain that more?
So the threshold refers to something we call herd immunity, or what level of immunity you need in the population to keep an infectious disease at bay. So measles is the most contagious disease we as humans face. And because of that, you need to have a very high level of immunity in the population, above 95% or so, or the virus will find individuals who are not vaccinated. And remember, children can't get vaccinated until around 12 to 15 months of age. It will find those individuals and it will infect them and continue to spread. So that's why to keep measles controlled, you have to have very high levels of immunity. And even if it sounds like 92% is high, it's not high enough for something like measles because it is so contagious. And that's why we have this issue now, is because our levels of immunity have fallen below that herd immunity threshold.
You know, when people hear cases are around 2,300, they may wonder whether that's actually a lot. Could you just put that into context for us? How unusual or usual is what we're seeing?
It's very unusual in this post-elimination status. And you had just had a statistic on screen where it was the 1990s, the early 1990s, when we had that level of infection. So it is extremely significant. Most years, it's kind of in the low 100s or so would be a bad year in the post-elimination status. And most of those cases are from isolated outbreaks like Disneyland in 2014. This is very, very significant because what you have are multiple states reporting multiple outbreaks. I think the CDC is reporting over 30 different distinct outbreaks in the United States. So this is exactly what I'm talking about with the virus becoming more common, reestablishing itself in the population. So this is really, really significant. And that number is going to only increase as we get through the rest of this year. And in November, we will probably lose elimination status formally in the United States.
So what's the significance between one nationwide outbreak versus maybe a series of smaller outbreaks that are adding up to these record numbers that we're seeing?
I think the significance is that there's multiple different states that have very low levels of immunity, or lower than you need for the threshold to keep this virus at bay. And it's not just one place. It's not just one outbreak. It's multiple pockets in multiple different states. So any place where they have individuals that are not vaccinated to a high level, if the virus gets into those communities, it will be able to spread basically unchecked because it is so contagious. And the resources, the public health resources to be able to investigate cases, to isolate cases, to do testing, all of that is going to be a big burden on multiple different municipal and state health departments. And this is money that they didn't need to have to spend because this is all voluntary. The solution here is simple. It's to get vaccination rates up, but people have chosen not to vaccinate, and that's why we're in this situation.
Are there any other factors that are causing these increased numbers, or would you say the vaccination thing is the biggest issue?
The vaccination thing is the biggest issue. Measles has always spread outside the United States and places like Europe. What kept us safe was our high vaccination level. So as soon as that vaccination level dropped, this virus, which was just there, I call it kind of a barbarian at the gate, it was there. It was ready to find people to infect. And that's what's happened. And the simple solution here is to get our vaccination levels back to that level that we enjoyed in the 2000s during the elimination era.
And I wanted to bring that up because we did learn that measles was declared eliminated in the United States back in 2000. How did we go from that success story to where we are today?
It's simple. We stopped vaccinating at the level required to keep that elimination status. The measles equation isn't a mystery. We've had a vaccine since the 1960s. As vaccine uptake increased, measles cases fell. And when we were above that herd immunity threshold, measles found the United States a very inhospitable place. Now we're below that threshold, and measles can spread because there's enough unvaccinated individuals for it to continue to find new people to infect. Kind of the paradox of this. It's a major problem to deal with, but it has a very, very simple solution.
So why is measles so good at finding new pockets of people to infect?
Measles is the most contagious disease, as I've mentioned, and it spreads through the air. So one person with measles might infect 10 or 15 other individuals. So because it can spread so efficiently in the air, if you were in a room with measles and then that you leave the room, an hour later, someone can come back in and get infected. That's just how contagious it is. So that's why it has such an easy time finding people that don't have immunity.
So for viewers who aren't following every headline necessarily, should they be concerned right now?
I do think if you are somebody that's not vaccinated, someone who has a child that's too young to be vaccinated, if you are immunocompromised, you should be concerned about measles because it is circulating in many different communities around the United States. If you're somebody that's fully vaccinated, no, you don't have to worry about measles infecting you, but you do need to worry about the fact that we're living in a country where measles is going to disrupt people's lives. And you're going to see exposures at airports, you're going to see exposures at schools. And all of this is voluntary. It doesn't have to be this way. And I think that's what should concern everybody, that we're kind of turning our back as a society, as a civilization, on a technology that kept measles at bay.
And I wanted to ask you, if somebody thinks their child might have measles or they might be sick, what should they do?
Well, the first thing they should do is call their primary care provider, because you don't want to just bring that person into the waiting room and expose other people because it is so contagious. And then often they will arrange for you to be tested, maybe through the back door. Maybe they'll send someone to get samples to test. And that's usually how you do it. If your child has unremitting fever, is short of breath, you need to seek medical attention immediately and be very open with your providers that my child was exposed to measles, might have measles, is not vaccinated, only had one vaccination, is too young to be vaccinated. You have to be very open with that so that clinicians know to think about measles, because many clinicians have not seen measles because they were trained during an era when measles was eliminated.
So what are you specifically going to be watching, let's say over the next few months or so, to see if this outbreak is getting under control or if it's getting worse?
I'll be looking at vaccination rates. Are they going up? Is the level of cases, is it plateauing, or is it continuing to increase? Are more states reporting more outbreaks? What are the level of hospitalizations? Are any people dying from measles? In 2025, 3 people died from measles in the United States. Those are the statistics I'm going to be looking at.
For anybody who might not fully understand this, what's one misconception about measles that you find yourself correcting time and time again?
That it's just some rash-like disease that everybody's grandparents had and everybody did fine. Measles is not just a benign illness. 1 in 5 children will get pneumonia. 1 in 1,000 will die. 1 in 1,000 will get brain infection. And a lot of them are showing up in emergency departments, in doctor's offices, urgent care centers. And if you have a safe and effective vaccine that can prevent even just needing to go to the emergency department, why not do that? So I think the fact is, well, people say, well, there's not that many deaths, that it's just either death or no death, and that's it. There's a lot in between. And I didn't even mention the fact that once you get measles, it sort of erases some of your immunity to other infections. So if someone gets measles, they become kind of vulnerable to things that they might have been vaccinated for. So this is not something that you want to get. This is something that you want to control with a vaccine that is safe and effective and been around for decades.
So if somebody did get measles and they became immune to those other vaccinations that they may have had, does that mean they have to get those again then, essentially?
There's no recommendation for that, but certainly a lot of people are debating that, whether or not there needs to be a recommendation or more study if boosting them again with new vaccines against things like pertussis and tetanus and all of the rest of them makes sense after a measles case. But that's still kind of not been officially recommended.
Dr. Adalja, before I let you go, is there anything else that we may have missed today that you want to touch on?
No, I think that this is just a sign of the times. And I think it's really important to recognize that science and technology are what kept these infectious diseases at bay. When you don't use them, they come back. They didn't go anywhere. They're still there. And I think that's the scary part, is that people are voluntarily choosing this lower standard of living.
All right, Dr. Adalja, thank you so much for your time and your expertise on Live Now from Fox. We appreciate it.